My name is Kara. I was just wondering whether my family has been informed of my whereabouts. Also, given the state of my leg, I was just concerned about making it to appointments and such.
Hi Kara, my name is Charlotte and I was the paramedic on scene. The other paramedics have your family and they've been notified of your whereabouts. You have been transferred from Charlesville Hospital to Brisbane due to your injuries, and the rest of your family have been transferred to Brisbane too. But I'll need to get back to you on which wards they're on. For now, let me introduce you to Jess. She is our nurse who will be looking after you.
Hi Kyra, how are you? I'll be your nurse for today, and I've just got the handover from Charlotte about your situation, and will be assisting you in going through your hospital journey and general care, as well as organising appointments with you and our pharmacist, radiation therapist, and medical imaging technician. I'll be here for you if you have any questions about your hospital care, costs, or any other concerns you may have.
It's good to meet you, Jess. I do have a few concerns over my care. As a mother doing a part-time degree, I was just wanting to know about the costs involved with the necessary treatment, and also whether any of the medications or processes conflict with some of the values of my people.
By taking a look at your patient notes, here I can see you identify as part of the Nunukal people on North Stradbroke Island. So what this means for you is that since your treatment will be taken in the Brisbane Hospital, which is part of the public system, the Australian government has a large expenditure. So this means most of your hospital finances will be subsidised by the government. Also, the Bureau of Health Information states that the largest gap between Aboriginal patients and non-Aboriginal patients is questions around privacy and health practitioners using medical jargon. As your nurse, it is part of my nursing standards that anything you tell me is confidential unless I deem it to be detrimental to your health. And with regards to all the medical terminology, my team and myself will be working together using the clinical yarning strategy. This is just a patient-centered method that unites Aboriginal cultural communication with scientific understandings of general health and disease. This will ensure you have a clear understanding of all your procedures and medications.
I was just wanting some help understanding the scans I've had. They've tried to explain it to me, but I don't quite understand the language and the implications of the findings.
Hi Kara, so with all your treatment, your main scan will be a CT scan. The term CT scan means computed tomography. This fancy word means 3D X-ray. When getting a normal X-ray, X-ray beams are targeted at a specific area on one side. For example, when you have a broken arm, a long machine will be pointed at the top of your arm, then an image will be captured. This image will be a 2D image that will show the bone structure. In some cases, like yours, radiographers may need more information. This is why we use a CT scan. The CT scan targets and photographs more defined features within the body. When searching for the cancer, we found shadows and inflammation which indicated an invasion of soft tissue. After the initial diagnosis of your cancer, you'll be referred to our radiation therapist, Max. From there, him and I will be working together to treat and monitor how your recovery is going.
How bad is the cancer? Has it spread? How aggressive will the treatment be? What are my options in terms of treatment, and how does it work?
I'm your radiation therapist. The severity of the cancer depends on the stage of the tumor and the size of it. We have found cancer at your thyroid, and at this stage, the tumor is relatively small, and if the tumor doesn't spread to other part of the body, while we apply adequate treatments, then we will have a high chance of curing it. In regards to your treatment, you will be receiving daily treatment through the use of radiation to treat targeted cells for 33 days, Monday to Friday. Basically, radiation therapy means the use of radiation, usually X-rays, to destroy cancer cells. I also have to inform you that radiation therapy may cause some side effects. You might experience tiredness, sore skin, and a change in the skin color in the treatment area. I will be discussing this with our pharmacist, and he will help you to reduce the side effect and make you recover faster.
Being a pharmacist for your case, I'll be involved in dispensing your medications to you. In this, I'll also be explaining to you what each drug does and how it may affect you. This will also include dosages and requirements. I'll be working with the nurse and the radiation therapist in order to keep track of your medications and to make sure we are giving you patient-centered care.
Are there any programs that make the access of these drugs easier? I have concerns over the cost and the processes for obtaining the correct medication. I've heard of the PBS and Medicare from some online government sites, but am I eligible?
Drugs will be supplied for you by the community GP. This means a lot of your medication can be subsidised by the Pharmaceutical Benefit Scheme, or PBS. As you are an Aboriginal woman, you can apply for a Closing the Gap subsidy, which means that instead of paying the patient amount for an ongoing treatment in the community, it is discounted from $38.80 to $6.30. Or, if you have a concession card, the medication you will be receiving will be free of charge. This will give less or no financial impact on you and your family.
I just have one more question. After my discharge, how will I be getting home?
When you are able to go home, we will transport you and your family back to Townsville. As for the rest of your treatment, it can be done locally. As lots of these treatments can cause drowsiness, you may need to ask a friend or family to transport you if you do not want to take emergency transport. If you wanted to discuss transport to and from the hospital, there are low cost and free options depending on where you live.
Thank you all for walking me through my hospital procedures. I'm so much more confident in the level of care I'm receiving.